Hello students, the topic is female reproductive system. So in this we are going to see the physiological anatomy of the female reproductive system, oogenesis, and then the menstrual cycle and its hormonal regulation. Is the reproductive years in female. If you take the reproductive years in female, it is between 13 and 46 years of age. Reproductive years in female is between 13 and 46 years of age. So what is the fundamental difference between male and female reproductive system? So in female, there is a cyclical release of gametes, whereas in male, it is a continuous phenomenon in male from puberty till death. So this is the fundamental difference between male and female. So physiological anatomy of the female reproductive organ. So if you take, there is an external genitalia and internal genitalia. So female external genitalia includes labia majora, labia minora, clitoris, vestibule of vagina and the vestibular glands. So these structures, they are collectively called as vulva. So this forms the external genitalia. Internal genitalia, so the female internal reproductive organs, that is the internal genitalia. So it consists of vagina, uterus, fallopian tube and ovaries. So this forms the internal reproductive organs. So the principal organs are the ovaries, fallopian tube, uterus and the vagina. So first we see vagina. So vagina, this is a tubular canal. So this is present anterior to the rectum and posterior to urethra and bladder. So the relation. So if you take the vaginal canal, posteriorly you have the rectum and anteriorly you have the urethra and bladder. So this vagina, it connects the opening of vestibule to the uterine cervix. So it's a tubular canal present anterior to the rectum and posterior to the urethra and bladder. If you take the length of the vagina, it is about 8 centimeter. So it's a tubular canal, 8 centimeter length. So this vaginal wall contains muscles and contraction of vagina, it occurs. So during the sexual act, it facilitates the transportation of the sperm into the uterus. So it contains muscle and the contraction of vagina during the sexual act, it facilitates the transport of the sperm into the uterus. If you take the vaginal epithelium, it changes. The vaginal epithelium, it changes during the phases of menstrual cycle. So phases of menstrual cycle, we have the follicular phase, luteal phase. So that we will be seeing in the menstrual cycle. You just remember proliferative phase. So in proliferative phase, what happens to the vaginal epithelium? So in proliferative phase, under the influence of estrogen, the vaginal epithelium becomes cornified. That is, cornification of vaginal epithelium occurs. So this secretes a thin mucus. So the cornified vaginal epithelium secretes thin mucus. This occurs in proliferative phase. In luteal phase, where there is a hormone progesterone, so under the progesterone, the cornification of epithelium is reduced, whereas there will be more infiltration of polymorphonuclear leukocytes. So and here they secrete thick mucus in luteal phase. So what happens after menopause? So the vaginal epithelium becomes thin and the secretion becomes scanty. So the post-menopausal vagina is dry and is susceptible to infection. So this is about a vagina. Next you have the uterus. So the uterus, it's a hollow organ having a thick muscular wall. So this uterus is placed between the bladder anteriorly and rectum posteriorly. So if you take the uterus, posterior you have the rectum, anteriorly you have the bladder. And what are the parts of the uterus? You have two parts, the body and the cervix. The body and the cervix. So the body is otherwise called the corpus. So the body of uterus, it consists of the two layers, myometrium and endometrium. So in the body of uterus, you have two layers, myometrium and endometrium, and inside that you have endometrium, you have the uterine cavity. Okay, so myometrium, endometrium and then uterine cavity. So what is myometrium? So myometrium is nothing but it consists of multiple layers of smooth muscle. So myometrium is nothing but multiple layers of smooth muscle. Whereas endometrium, you have two layers in the endometrium. One is stratum basal and other one is stratum functional. So stratum basal, so see this picture, the stratum basal is towards the myometrium and stratum functional is towards the uterine cavity. So this stratum functional is the inner 2/3 layer. Okay, so this stratum functional only, it will be periodically sloughed off and regenerated once in a month. So during the menstrual cycle phase, during the menstruation, this stratum functional layer is periodically sloughed off and regenerated once in a month. So in the body of uterus, you have the myometrium, endometrium. Myometrium is full of multiple layers of smooth muscle. Endometrium, you have the stratum basal and stratum functional. Stratum functional only periodically sloughed off and regenerated once in a month. So see this picture, stratum functional, stratum basal. So this is to just to have an idea. See the vagina, the cervix, and see the endometrium, myometrium, uterine cavity. Yes. Next is the uterine cervix. So this is a narrow muscular tube. The uterine cervix is a narrow muscular tube. So this connects the vagina with the body of uterus. So this cervix has an internal os. Then you have the cervical canal. Then the external os. And there will be secretion of mucus in the cervix. So the cervical mucus, the consistency changes. So the consistency depending upon the which phase, whether it is a proliferative phase or in the secretory phase, depending upon the phase and the hormones. So the consistency of the cervical mucus changes. So it changes from thick viscous liquid to a profuse watery and highly elastic liquid. So it changes, the consistency changes, and this highly elastic liquid, the elastic liquid which forms the physiological basis of the Spin-Barkey test. So this is a test for ovulation. So Spin-Barkey means highly elastic substance. Spin-Barkey means highly elastic substance. So it forms a physiological basis for the test for ovulation. Whereas under the influence of estrogen, the cervical mucus, it forms a typical fern pattern. So typical fern pattern, but this disappears after ovulation. So the cervical mucus, it changes, the consistency changes depending on the various phases of the menstrual cycle. Next is the fallopian tube. It is also called oviduct. So there are two fallopian tubes arise from both sides of the upper pole of the uterus. So this fallopian tube or oviduct is about 10 to 15 centimeter in length. If you take the parts of the fallopian tube, it has an interstitial part, that is a part which is going inside the body of uterus, and then you have the isthmus, and then you have the ampulla, infundibulum, fimbrial part. So see this picture, interstitial, isthmic, ampullary, infundibulum and fimbrial end. So this is the parts of the fallopian tube. So interstitial part is the part that is going opening part of in the uterus, and isthmus, ampulla, infundibulum and the fimbrial end. So the fertilization takes place in the ampulla, ampullary part of the oviduct. And then the fertilized ovum is transported into the uterine cavity for implantation. See, the infundibulum opens into the pelvic cavity. See, the infundibular part, it opens into the pelvic cavity. So this is close to the ovaries. And also the infundibular opening has a finger-like projection called the fimbriae. Finger-like projection called the fimbriae. So this fimbriae that helps in grasping the ovum at the time of ovulation. So when the ovum is released, it will grasp the ovum. Which one? The fimbriae. See, there is ovary. When the ovum is released, so the fimbriae, it will grasp the ovum. So it will be taken inside the oviduct. So in the ampulla, so there will be fertilization occurs. Fertilization takes place in the ampulla part. So when the fertilized ovum, when the ovum is fertilized, so it will be taken into the uterine cavity for implantation. Next is the ovaries. So there are two ovaries. They are attached by the ovarian ligament. So each ovaries weighs about 10 grams in adult. So in the ovaries there are two zones, the cortex and the medulla. So the cortex is the outer and the major zone. So this is lined by the germinal epithelium, and in the cortex it contains oocyte, and there are various ovarian follicles present in their various stages of the development. And this oocyte is enclosed within the ovarian follicle. So the mature ovarian follicle is called the Graafian follicle. So all this about the ovaries, it will be taken in your next class, that is the folliculogenesis class. So where they talk about the various stages of the follicles development and the ovulations. So you know in the cortex, the cortex is the outer major zone. It contains the oocyte, and each oocyte is enclosed within the follicle called the ovarian follicle. So there are various stages of ovarian follicles, so that are also present in the cortex. And the mature ovarian follicle is called the Graafian follicle. See, there are two ovaries. And medulla, so it's the inner zone of the ovary that forms the medulla. So in the medulla it contains the interstitial and the connective tissue cells. So cortex outer zone, medulla is the inner zone which contains the interstitial and connective tissue cells. The blood vessels and the lymphatics enters the ovary through its hilum. Next is functions of ovary. So ovary like testis, it performs many functions. So oogenesis, so during the fetal life, then maturation of oocyte, ovulation, and secretion of the female sex hormones, estrogens and progesterone. So these are the functions of ovary. The primary function of ovary is to develop the ovarian follicle and release ovum at the time of ovulation. The primary function is to develop ovarian follicles and release the ovum at the time of ovulation, and also to secrete the steroid hormones, which controls the various reproductive functions. So female hormone system. So what are the hormones so involved are the hypothalamic releasing hormones, GnRH, the anterior pituitary sex hormone, follicle stimulating hormone and luteinizing hormone, and the ovarian hormones, estrogen and progesterone. So these are the female hormonal system. So these hormones are involved in the regulation. So that we will be seeing in each part. So what are the roles of each hormones? So GnRH, FSH, LH, estrogen and progesterone. Next comes the oogenesis. So this oogenesis, it starts in fetal life. See, unlike spermatogenesis that starts at puberty and continues throughout the life, whereas the process of oogenesis that starts in the fetal life and ceases at menopause. Also, the development of each oocyte that begins in intrauterine life and is completed with ovulation. See, the process of development of each spermatocyte is completed in few days. The process of each spermatocyte, development of each spermatocyte is completed in few days, whereas the development of each oocyte that begins in intrauterine life is completed with ovulation that occurs during menstrual cycle. So this is a very important one. So this is completed. Which one? The development of each oocyte which begins in intrauterine life. Begins, but it's completed with ovulation that occurs during each menstrual cycle. So the development of oocyte occurs in 3 stages. So oogonium becoming the primary oocyte, and the primary oocyte to secondary oocyte, and secondary oocyte to mature ovum. So it occurs in 3 stages, the development of oocyte. So first, oocyte. So oocyte, the primordial germ cells are called the oogonia. So the primordial germ cells, otherwise called oogonia. So these germ cells, they migrate from the yolk sac of embryo. So they migrate from yolk sac of embryo to the genital ridge, at about 6th week of gestation. So they migrate at about 6th week of gestation from yolk sac to the genital ridge. And this Oogonia, they undergo mitotic divisions. So repeated mitotic divisions, many mitotic divisions. They undergo many mitotic divisions and they reach about 7 million in the month of 5th to 6th month. So on 5th to 6th months, so under mitotic divisions, they become 7 million in number. So when mitosis ceases, the oogonia are called oocyte. So mitosis means multiplying divisions. So they become 7 million in number around 5 to 6 months. So when the mitosis ceases, so these oogonias are called the oocyte. So primordial germ cells are oogonia under mitotic divisions, they forms the oocyte. So this oocyte, in the initial stage of development, it is called the primary oocyte. So primordial germ cells, mitotic divisions to form the oocyte. So the initial stage of development, these oocytes are called the primary oocyte. So this primary oocyte, so it undergoes two meiotic divisions. So the first meiotic division, it starts in the primary oocyte during the fetal life, which occurs about 8th week of gestation. So the first meiotic division, it starts in the primary oocyte during the fetal life, which that is around about 8 weeks of pregnancy. And this meiotic division is arrested in prophase. This is arrested in prophase. So this first meiotic division is not completed in the fetal life, not even in puberty. It is completed just prior to ovulation. So this first meiotic division, it is arrested in the prophase. So first meiotic division is completed just prior to ovulation. So atresia, what is atresia? This oocyte undergoes degeneration. Oocyte undergoes degeneration. So the process of degeneration of oocyte is called the atresia. See, this oocyte degeneration, however, it starts from the intrauterine life. So there are about 1 million primary oocyte present at the time of birth. So at birth, 1 million primary oocyte. And so by the time of puberty, it is about 2 lakhs. And at the age of 30, it is about 26,000 oocytes remains in the ovary. And at the menopause, the ovaries are virtually devoid of oocytes. So it's gradually, so degeneration, oocyte degeneration. So if you take the woman's life, only about 400 oocytes are ovulated and other oocytes, it degenerates. So this process of degeneration of oocyte is called the atresia. So only 400 to 500 oocytes are ovulated, other degenerate. So oocyte maturation inhibiting factor. So this arrests the primary oocyte in prophase. So there are two meiotic divisions. So the primary oocyte undergoes first meiotic division. So this gets arrested in the prophase. So this is arrested by the oocyte maturation inhibiting factor that arrests the primary oocyte in prophase. Next, the primary oocyte is converted into secondary oocyte. The selected primary oocyte for ovulation completes the first meiotic division. So the selected primary oocyte for ovulation completes the first meiotic division. So this forms the secondary oocyte and first polar body. So this completes the first meiotic division just before the ovulation. So just before ovulation, the first meiotic division is completed. So it forms secondary oocyte and first polar body. So what is the secondary oocyte first polar body? See, the cytoplasmic division is grossly unequal in this process. The secondary oocyte retains nearly all the cytoplasm with the polar body containing very little of it. So thus the polar body becomes completely non-functional. So most of the cytoplasm it retains in the secondary oocyte. The polar body contains only little cytoplasm. So the polar bodies, they becomes completely non-functional. So the selected primary oocyte for ovulation completes the first meiotic division just before the ovulation. Next, the secondary oocyte forming the ovum. The second meiotic division occurs in the secondary oocyte after ovulation. So, and this is arrested in the metaphase. So, the second meiotic division occurs in the secondary oocyte after ovulation and is arrested in metaphase. So first meiotic division, it's get arrested in the prophase, and second meiotic division it arrested in the metaphase. So when the second meiotic division is completed, so this is completed when the egg is penetrated by a sperm. So thus meiotic cycle is completed only on fertilization. So as a result of this meiotic division, the ovum containing 23 chromosome and second polar body are formed. So ovum and a second polar body is formed. So ovum containing 23 chromosome and second polar body is formed. So when the second meiotic division is completed only on fertilization. So thus in the process of oogenesis, each primary oocyte produces only one ovum. See here, so the oogonium. So the primordial germ cells or the oogonium, it undergoes mitotic divisions. It forms the primary oocyte. So this primary oocyte, it undergoes the first meiotic division at about 8 weeks of pregnancy, and this is arrested in the prophase. So this first meiotic division is completed just prior to ovulation. Next, the primary oocyte, so here the secondary oocyte and a first polar body is formed. Next, the secondary oocyte, it undergoes the second meiotic division, but this are arrested in the metaphase. So when this get completed, the second meiotic division, so the second meiotic division gets completed when the egg is penetrated by the sperm. So finally, the process of oogenesis, it forms only one ovum. So from each primary oocyte, it produces only one ovum. So see, mitosis, oogonium, mitosis, primary oocyte, first meiotic division, then second meiotic division, and then you are getting the ovum and second polar body. So the ovarian changes during sexual cycle completely depends upon the follicle stimulating hormone and luteinizing hormone. See, all the ovarian changes, the folliculogenesis, that will be taken as a separate class. So different stages of follicle development and the ovulation and what are the hormones that regulating it, all will be taken as a separate class in the next class. Next comes the menstrual cycle. So next comes the menstrual cycle. So far we have seen about the physiological anatomy of the female reproductive system. So the external genitalia, the internal reproductive organs, and about each the organs, vagina, uterus, fallopian tube, and the ovaries, and then oogenesis. So oogenesis, so from oogonia becoming the primary oocyte, then the primary oocyte to secondary oocyte, and then the ovum. So now is the menstrual cycle. So the length of menstrual cycle, it averages about 28 days. So it ranges from 21 to 35. So the duration of cycle is never fixed in all women. So it ranges from 21 to 35 days. Also the duration of all cycles is not same in one woman. So this is keep on changing. So this because the menstrual cycle is frequently influenced by psychological factors, environmental factors, nutritional factors, and social factors. So all this will influence the duration of cycle. So this is not fixed in all women. So it ranges from 21 to 35 days. And physiologically, the menstrual cycle ceases during pregnancy and lactation. So the cycle is described by number of days. See, the first day being the day of beginning of menstrual bleeding. So the first day is the day of beginning of the menstrual bleeding. So what is endometrial cycle? So endometrial cycle is defined as cyclical changes that takes place in the endometrium of uterus during each month. So we have seen in the body of uterus the two layers, myometrium and endometrium. So this endometrium, it undergoes cyclical changes during each month. So that is called the endometrial cycle. So this endometrial cycle is divided into three phases. Proliferation of uterine endometrium, development of secretory changes in the endometrium, and the desquamation of endometrium, that is the menstrual phase, that is the bleeding phase. So there are three phases in the endometrial cycle. First is proliferation, secretory changes, and then the menstrual bleeding phase. So see in this picture, see here, so these are the follicles, various stages of development of the follicles. So here the hormone estrogen and the hormone progesterone. So this is where the time of ovulation. And so this is the endometrial thickness. See the thickness. So here menstrual, proliferative phase, secretory phase, again the menstrual bleeding phase. See the thickness of the endometrial thickness. See here. So after the menstrual phase, see the thickness of endometrium. And here the proliferative phase begins, the thickness of endometrium also increases. And see thickness of the endometrium during the secretory phase. And again the thickness decreases. So the major hormone here is the estrogen in the proliferative phase. The major hormone secretory is both progesterone and estrogen. Okay. Here the follicular phase and the luteal phase. So that I will discuss what is follicular phase, luteal phase. Is proliferative phase, estrogen phase that occurs before ovulation. So in this picture we have seen, no? So before ovulation, the dotted lines. The dotted lines, that is the ovulation time. Before ovulation is the proliferative phase. So this is estrogenic phase. The estrogen hormone controls that one. So this occurs after menstruation. After menstruation, only thin layer of endometrium is left. See the thickness of the endometrium, only thin layer of endometrium is left. So the proliferative phase begins. So only thin layer of endometrium is left after the menstruation. Under the influence of estrogen from the follicle, the thickness of endometrium increases from 5 to 14 days. 5 to 14 days. From day 5 to day 14, that is 14 days is the ovulation day. So up to that the endometrial thickness increases. Re-epithelialization within 4 to 7 days. So there is a re-epithelialization will also occurs. And the endometrium undergoes hyperplasia and hypertrophy. So hyperplasia, hypertrophy, there is increase in the size and thickness of the endometrium. And the endometrial glands, it lengthens and the glands are drawn out. So these glands are lined by the columnar epithelium. And the spiral arteries increases in the endometrium. The endometrial veins grows in size. So the endometrium is vascularized with the formation of more number of spiral arteries. So that increases blood supply to the deeper layers. So this increased blood supply further promotes the growth of the uterine mucosa. And the myometrial excitability also increases due to the effect of estrogen. The myometrial excitability also increases. So these are the uterine changes that occurs during the proliferative phase. During the proliferative phase under the influence of the estrogen. So what happens? So after menstruation only thin layer of endometrium is left. So the thickness increases. Next, re-epithelialization. Next, there is increases, size and thickness of the endometrium increases because of hyperplasia and hypertrophy. Endometrial glands also lengthens. And then the spiral arteries, more number of spiral arteries, more formation of spiral arteries. So increase blood supply and the endometrial veins also grows in size. So all this will increase the thickness to about 3 to 5 millimeter thickness at the time of ovulation. So the time of ovulation, the endometrial thickness increases to 3 to 5 millimeter thick. See here, see this is after the menstruation, very thin layer, and see the dotted lines are ovulation. See the thickness, it's increasing, gradually increasing the thickness. So the thickness increases. So here the hormone is the estrogen. And here the hormone is progesterone. See here also the thickness is increased. So next is the secretory phase, the progestational phase occurring after ovulation, because main hormone here is the progesterone. So this secretory phase occurs after ovulation. So estrogen, progesterone secreted from the corpus luteum. The estrogen causes additional proliferation. Estrogen causes additional proliferation. The progesterone, it causes marked swelling and secretory development in the endometrium. Here, the uterine glands become coiled and tortuous. So here, both the combined effect of estrogen and progesterone is there, but however the major changes in the secretory phase is because of the progesterone. So because of the progesterone, the uterine gland becomes coiled and tortuous. And the glandular cells, it stores glycogen and secretes large quantity of carbohydrate-rich mucus and fluid. So for this phase is called the secretory phase. Why this phase is called secretory phase? The glandular cells, they store glycogen and secrete large quantity of carbohydrate-rich mucus and fluids. And the vascularity of endometrium increases further due to the combined effect of the estrogen and progesterone, and the spiral arteries become tortuous. And the endometrium becomes edematous and thickened. So due to increased blood supply and increased secretion, the endometrium becomes edematous and thickened. So what are changes that occurs during the secretory phase? So the uterine gland become tortuous, coiled and tortuous. The glandular cells stores glycogen and secretes large quantities of carbohydrate-rich mucus fluid. And the vascularity of endometrium increases further due to the combined effect of estrogen and progesterone, and spiral arteries become tortuous. Because of increased blood supply and secretion, the endometrium becomes edematous and thickened. So, what are the changes that occurs during the proliferative phase, which is under the control of estrogen, and what are the changes occurs during the secretory phase? Next is the menstruation. So, menstruation, corpus luteum degenerates. So, what is this corpus luteum? See, after ovulation, so the ruptured follicles, the follicles ruptures and release the ovum. The ruptured follicles is quickly filled with blood. So at this time, this follicle is called corpus hemorrhagicum. But the cells lining the follicle, what it will rapidly proliferate to replace the blood with luteal cells. So it is filled with blood. Initially it is filled with blood. The ruptured follicles is filled with blood. So that is called corpus hemorrhagicum. But rapidly the cells lining the follicle will proliferate to replace the blood with luteal cells. So now the follicle is called corpus luteum. So that is corpus luteum. So it is called luteal phase. So you have follicular phase and luteal phase. So because of corpus luteum, this phase is called the luteal phase of the cycle, luteal phase. So this corpus luteum, if fertilization does not occurs, this corpus luteum it degenerates. So if fertilization of the ovum does not occurs, so the corpus luteum it degenerates in about 13 days after ovulation. So ovulation after 13 days, this corpus luteum it degenerates. The corpus luteum secretes hormones. So during this luteal phase, there will be increased secretion of progesterone, estrogen and other hormones that will be secreted from this corpus luteum. So if the corpus luteum degenerates, means no hormones will be there. So the hormonal support of the endometrium is withdrawn. So the endometrium it becomes necrotic. So decreased estrogen and progesterone. So coiled arteries constrict and decrease blood supply to the endometrium. So the corpus luteum, so it secretes the hormones. So when the corpus luteum degenerates, so there is a decreased progesterone and estrogen. So there is a reduction in the steroidal hormones. So what happens when there is a reduction in the hormones, there will be a destabilization of the lysosomal membranes in the endometrial cells. So this destabilization of the lysosomal membranes endometrial cells leads to release of proteolytic enzymes and also production of prostaglandins. So prostaglandin is PGF2 alpha. So this prostaglandin, it will cause the vasoconstriction of the coiled arteries. So when there is a vasoconstriction of the coiled arteries, what happens? There will be endometrial ischemia. So decreased blood supply to the endometrium. So decreased blood supply to the endometrium will lead to ischemic changes that result in area of local necrosis. So there will be necrosis of the endometrium. So the blood seeps into the vascular layer. So this foci of necrosis, they joins each other, and what will do, it will, the necrotic area separates and it will slough the uterine endometrium. So how the menstruation occurs? So after the ovulation, the ruptured follicles will be filled with the blood. That is called corpus hemorrhagicum, and this blood will be replaced by the luteal cells, that is called the corpus luteum. If fertilization does not occur, this corpus luteum undergoes degeneration. Since hormones secreted by the corpus luteum, so if the corpus luteum undergoes degeneration, the hormonal support will be withdrawn. So the endometrium becomes necrotic. So how it becomes necrotic? When the steroid hormones are not there, so there will be release of proteolytic enzymes and production of prostaglandins. So this prostaglandin causes vasoconstriction of the spiral coiled arteries. So there is decreased blood supply to the endometrium. So there is ischemia and area of local necrosis. So all this will lead to sloughing of the endometrium. So during the normal menstruation, so there is about the blood loss is about 40 ml and the serous fluid is 35 ml. And this menstrual blood contains the tissue debris, prostaglandins and fibrinolysins. So this fibrinolysin is present in the menstrual fluid, so there is no clotting. So it is non-clotting. So we have seen the endometrial cycle. So in the endometrial cycles that occurs in the three phases. So proliferative phase, secretory phase and the menstrual phase. So proliferative phase, so the thin endometrium, the thickness increases. So this is under the control of estrogen. And then secretory phase, this is after ovulation. So this secretory phase, both estrogen and progesterone will be there, but major the changes are due to the progesterone. And the menstrual phase, so how the bleeding occurs, sloughing of endometrium occurs. So the phase of menstrual cycle, they have divided into follicular phase and the luteal phase. So these two are separated by ovulation. So what is this follicular phase and luteal phase? So follicular phase starts from onset of bleeding to the day of ovulation. So from the onset of bleeding to the ovulation. So two parts, menstrual phase and the proliferative phase. So the menstrual phase and the proliferative phase, it comes under the follicular phase. And luteal phase between ovulation and the next onset of the bleeding. So ovulation and next bleeding, so that phase is called luteal phase. So the luteal phase is always constant, that is 14 days. So the two phases, follicular phase, luteal phase. So don't confuse with the endometrial changes, the proliferative secretory. So follicular phase means it includes the menstrual and the proliferative phase. And luteal phase is ovulation and the next bleeding. So that period is always constant 14 days. So what are changes in the reproductive organ during the follicular phase? So ovarian changes, so that will be taken as a separate. So all the folliculogenesis, primordial follicle, primary follicle, that will be taken in the next class. So that is ovarian changes, ovulation. Uterine changes, we have seen that. So that is uterine changes during the follicular phase. What happens in the menstrual phase, what happens in the proliferative phase. So that is the uterine changes during the follicular phase. So menstrual changes means that's sloughing of endometrium, you know that one. And the proliferative phase under the influence of the which hormone? It is the estrogen. So what happens? The uterine changes. So estrogen means there will be hyperplasia, hypertrophy of the endometrium, the endometrial glands lengthened, the more formation of spiral arteries, endometrial veins also grows. So all this happens, the uterine changes during the proliferative phase, because the proliferative phase comes under the follicular phase. And changes in the uterine cervix. So this one you should know. So what are the changes in the uterine cervix? So under estrogen, because the major hormone is the estrogen. So under estrogen, the volume of cervical mucus increases and alkalinity and elasticity of the cervical mucus increases. So these are changes in the uterine cervix. So cervical mucus when the increase ago, alkalinity and elasticity of cervical mucus increases under the influence of estrogen. What happens in the vagina? So under estrogen, the epithelium becomes cornified. The beginning itself we have seen. So under estrogen, the epithelium becomes cornified. That is keratinized. What happens in luteal phase? Luteal phase means that is ovulation and the next bleeding. So it almost covers the secretory phase. So major hormone is progesterone. So ovarian changes, that will be dealt separately. And uterine changes, you know the uterine changes. What happens in the secretory phase? So the gland becomes coiled, tortuous, and the the glandular cells, they secretes large quantities of carbohydrate rich fluid, so that is called secretory phase, and the vascularity of endometrium increases, spiral arteries become tortuous. All this happens in the uterine changes and changes in the cervix. So progesterone, the cervical mucus become thick and elasticity decreases. Cervical mucus become thick and the elasticity decreases. So what happens in the follicular phase under estrogen, the elasticity increases, whereas here the elasticity decreases, the cervical mucus become thicker. This is one important one you should note. And vaginal changes, so it secretes thick mucus and the epithelium is infiltrated with leukocytes and the cornification decreases. So you have the follicular phase and the luteal phase. So follicular phase, it includes the menstrual phase and the proliferative phase, and luteal phase means you should know about the secretory phase and you should know the hormones. So this is a whole picture. See here, follicular phase of menstrual cycle, luteal phase of menstrual cycle. See the follicular phase of menstrual cycle. So this is a menstruation. See the thickness. After menstruation, thickness of the endometrium is very thin, and from day 5 to 14, the thickness increases. So this phase is the proliferative phase. So menstruation and the proliferative phase both comes under the follicular phase. Okay. Next, this is the line is the ovulation, and here this is the secretory phase. So that is the luteal phase. So from the ovulation to the next bleeding, so this is the luteal phase. See here the hormone levels, the estrogen, and see the estrogen and progesterone level. So the progesterone level is more here and the estrogen level is more in this phase. So here more, see the progesterone level is low, and here the progesterone is more, the estrogen is comparatively less, but both are here, but major effect is because of progesterone in the secretory phase. And see here there is various stages of development of the follicles, and see at the line is the ovulation. See the follicle ruptures and releasing the ovum. So this is the small dot is the ovum, and see this is the corpus luteum. So initially the ruptured follicle is filled with blood and then replaced with the lutein cells. This is corpus luteum. So this corpus luteum, it secretes the hormone estrogen and progesterone. So when the menstruation occurs, so when there is no fertilization, so this corpus luteum, it undergoes a degeneration. So the hormonal support is withdrawn. So there is a release of proteolytic enzymes and prostaglandins. So there is a constriction of spiral arteries and necrosis, ischemia, necrosis of the endometrium. So there is a sloughing of endometrium. So interplay between the ovarian hypothalamus pituitary hormones. So how this hormones playing here? So from hypothalamus, the gonadotropin releasing hormone is coming. It acts on the anterior pituitary to release the LH and FSH. So this is an important one. So the GnRH secretion is not continuous one. The gonadotropin releasing hormone, it's a pulsatile release. It's not a continuous, it's a pulsatile release. So the release lasts for 5 to 25 minutes every 1 to 2 hours. So the release is lasting for 5 to 25 minutes in every 1 to 2 hours. And this causes intermittent release of the LH every 90 minutes. Okay. So the hypothalamic center for GnRH release is the arcuate nuclei. And the negative feedback effect of estrogen and progesterone to decrease LH FSH secretion. So there is a negative feedback effect of estrogen and progesterone. So this decreases the LH and FSH secretion. So this LH FSH will act on the ovary, and there is a release of estrogen and progesterone. So this estrogen and progesterone has a negative feedback effect on the LH and FSH. It inhibits FSH and LH. So this is for your knowledge. So all the ovarian hormones that will be taken in a separate next class. So positive feedback effect of estrogen. So estrogen from follicle, when concentration reaches 200, it maintains high concentration for 36 hours. The estrogen stimulates LH secretion. So if you know about the hormones, then you can understand. I'm skipping this topic. So in the next class, so once you know about the estrogen progesterone, you will understand this. Okay. So we'll go to the disorders of menstrual cycle. So what are the disorders of menstrual cycle? You have amenorrhea, hypomenorrhea and oligomenorrhea, dysmenorrhea, menorrhagia, metrorrhagia and polymenorrhea. So what is amenorrhea? So absence of menstrual cycle is referred to as amenorrhea. So absence of menstrual cycle. So this amenorrhea have two categories, primary and secondary. See, primary amenorrhea means, so here the menstruation has never occurred. The menstruation has never occurred. So this is called primary amenorrhea. Secondary means when the menstrual cycle stops in a woman who had a normal cycles before. So normal cycles la irundirukku, but the menstruation stops. So that is secondary amenorrhea. So the various causes. So primary amenorrhea you have physiological and pathological. So physiological primary amenorrhea. So physiological amenorrhea means the physiological amenorrhea is more common than pathological. So this physiological amenorrhea, that's before puberty. Before puberty, the amenorrhea is normal in childhood and pre-pubertal age, because usually menstruation starts at age of 12 to 14 years. Pathological means when the menstrual cycle does not start till the age of 18 years. So because of some diseases. So it usually occurs due to any congenital or genital defects like Turner syndrome, Kallmann syndrome. So this is pathological primary amenorrhea. And secondary means, so previously they had a normal cycles, but now the menstrual cycle stops. This is called secondary amenorrhea. So secondary amenorrhea, you have the physiological causes, pathological causes. So physiological causes, pregnancy and lactation. So in pregnancy and lactation, there will be no menstruation occurs. So pathological secondary amenorrhea, so whenever there is any hypothalamic disorders, pituitary disorders, ovarian disease, any uterine pathologies, all will lead to pathological secondary amenorrhea. Okay. So amenorrhea is nothing but absence of menstrual cycle. So in that you have the primary and secondary amenorrhea. Primary means menstruation has never occurred. Secondary means previously normal cycles are there, but now the menstrual cycles have stopped. Okay. So there are various causes. Next, hypomenorrhea and oligomenorrhea. Hypomenorrhea means decreased menstrual bleeding in duration, amount or both. This is called hypomenorrhea. Hypomenorrhea means duration also decreases, the amount of bleeding also decreased, both. That is hypomenorrhea. What is oligomenorrhea means? Decreased frequency of cycle. So cycles more than 35 days of menstrual cycle. This is called oligomenorrhea. So hypomenorrhea is different from oligomenorrhea. Then what is dysmenorrhea? It's nothing but painful menstrual bleeding. So dysmenorrhea is nothing but painful menstrual bleeding. Menorrhagia. What is menorrhagia? Increased menstrual bleeding in amount, duration and both. So this is called menorrhagia. What is metrorrhagia? So metrorrhagia means bleeding occurring between the periods. That is called metrorrhagia. So in between the periods, acyclical and irregular periods you will get in between bleeding. So occurring between the periods. So this is called metrorrhagia. Polymenorrhea means when the menstrual cycle occurs frequently, that is less than 21 days. So oligomenorrhea opposite polymenorrhea. Oligomenorrhea means cycles more than 35 days. Polymenorrhea means cycle less than 21 days. So frequently the cycle occurs. So this is called polymenorrhea. So usually the amount and duration of bleeding remains normal in case of polymenorrhea. So these are the disorders of menstrual cycle. So far we have seen about to summarize. So menstrual cycle. So what is menstrual cycle and what is endometrial cycle? So endometrial cycle, what are the changes that occurs in the endometrium? So in that you have the three phases: proliferative phase, secretory phase and the menstrual phase. So you know what are the hormones in the proliferative phase, what are the hormones in the secretory phase, why the menstruation occurs menstrual phase. So three phases. The menstrual cycle you have main two phases, follicular phase and the luteal phase. So follicular phase, it includes the menstrual and the proliferative phase, and luteal phase now the ovulation to the next bleeding. So mainly the secretory phase. So you should know what are the hormones mainly influencing and the other changes in the cervix, uterus all the changes we have seen. The ovarian changes, so that will be taken as a separate class. So ovarian changes, follicle development, folliculogenesis, ovulation, all will be taken as a separate class. So then the disorders. Thank you.